whatever. It's all good.
Good. Is it running?
Yeah.
Hey everybody, Doug again. Last time I told you I was going to talk to Andrew, who is a friend. He's been my therapist, I guess even a colleague. And how long have we known each other? Maybe 10 years now?
It's been a while, yeah, for sure. 2010.
2010, so 8 years.
Yeah.
Anyway, last time I talked a little bit about my right shoulder issues, and I am 3 days out from total shoulder replacement. Andrew's the one who really introduced me to chain reaction biomechanics, which is just a fancy way of saying that the foot's connected to the knee, to the hip. And I talked last time a little bit about how I think my shoulder got bad. It wasn't from one single event. It was overuse, I think, and ignoring pain. So I thought it would be interesting and valuable for you guys to hear a little bit of what Andrew has to say as a physical therapist. He owns his own clinic here in Traverse City, Michigan, my hometown. Knowing what you know about my shoulder already, I'll just ask Andrew some questions. And first, let me ask, when do you think it's appropriate, in general, you can talk about my shoulder if you want, and you know my situation, but in general, when do you think it's appropriate to get surgery and not to have surgery? Because that's always a difficult decision. This is the fourth surgeon that I've seen, and I went through a lot of therapy with Andrew, and I think it was all very useful because I learned a lot, and it did push surgery back, and I think that was important for me at 52. But at some point, I think you agreed that it was time probably to get surgery. For me, it wasn't a pain issue anymore, it was a lack of motion. I have such limited motion. So what are your thoughts on that, Andrew?
Yeah, I think it's always a good idea to be as conservative as possible for as long as you can tolerate before a surgery. And why I say that is because most of the time we're making surgical decisions based on the structure that we see in an x-ray or an MRI. And within the last 3 or 4, maybe 5 years, there's been a ton of evidence to come out, research to come out that supports the idea that it doesn't matter what body part we're talking about, whether it's the knee or the back or the shoulder, there is a large amount of people, let's say for example, there's an asymptomatic imaging study that shows that 60% of people over the age of 50 have a rotator cuff tear in their shoulder, but they don't have any pain. Mm. But if you talk to them, there was a time period when they remember having pain,
yeah.
And time went on, whether they treated it or not, and that pain, the body learned to basically compensate, and then the pain's gone, and if you look at their function is also fine. So you have this equation of like symptoms and quality of life, as well as how functional, or how can I move, how can I do the things I want to do. So for you, it wasn't really pain, but it was like, man, you were pretty limited in your abilities to do things, your function. So that's where it's interesting because, there's a lot of people that's the other way around, where it's more pain driven and they run and get surgery quickly, like within the first 2 to 3 months of the pain onset. And when you look at these studies, especially low back pain, for example, we know that studies show 85% of disc herniations will go away, or the pain will go away after 6 months of the onset. Mm-hmm. So when you look at like what's the timeline that I should wait for surgery, if there isn't really a textbook for it, but I would say in my mind, I'm waiting somewhere between 6 and 12 months.
Right.
And then I'm going to see, and I'm going to try to do some things.
Sure.
To help
some strategies to like therapy,
massage, physical therapy, movement based.
Avoiding some of those things that hurt.
Yeah, sure. I mean, that's always a good idea. But I'm going to try to do as much as I can to get conservative treatment, and that might even include medications. It might include injections. It might include. There's a lot of treatments out there that you can do before surgery.
And is that in part because once you have the surgery, especially the type of surgery that I'm getting, replacement of my shoulder, you can't go back. Right. You can't undo that.
Reality is it's a risk-reward equation. So like the surgery, in reality, whether the surgeon's telling you this or not, or whether you're reading about it or not, it is a high-risk procedure. There's elements there that from the anesthesia, it's high risk. You can look up numbers on that. What are the things that happen to people? You can look up the surgical complications, infections. The two leading causes of problems after an orthopedic surgery are blood clots and pneumonia. So those are unrelated to the surgery going wrong, but those are side effects of the
Sure.
body basically going through anesthesia and not moving.
Real
for a period of time.
risks. Real risk of
So-
having the
yeah.
surgery. If you're not really sure and you don't have a lot of pain and it isn't restricting your lifestyle, that all makes sense.
Right.
For me, I have been dealing with this for 10 years. I did have a period of time when I had some pain, but the nature of my career, as I said in the last video, as a personal trainer and being fairly active as a kind of a low-level athlete, I had a difficult time avoiding those things that I believe now played a role in that. So you knowing we did a lot of therapy together. I think at some point I did everything that I could with yoga, with therapy, with even changing my diet, avoiding those things that bothered it. I don't do any heavy lifting anymore, but it is starting to affect my lifestyle now. Just putting a coat on and the little things. So it's not a pain issue; it's become a lifestyle issue. I don't like doing this at 52, but I feel like if I wait too long, I may have to get a reverse, and I don't want to do that.
Right.
I feel like I'm still able to get an anatomical. So, do you want to talk for a second about this idea, this notion of chain reaction biomechanics? So, you've said to me before, and there might be some stats behind this. How often do you treat their pain, treat them where their pain is?
Right.
A lot of people think, oh, I got a bad back, it must be my back's fault, and I just need my back treated.
So I look at it as like you've got three main categories you can treat. You can treat the symptom, you can treat the compensation, or you can treat the dysfunction. And so, what are we always trying to treat? We're always trying to treat the dysfunction, because if you treat the dysfunction, the compensation will go away, and then the symptom will resolve. And it's really hard because you find yourself with a patient, or even as a provider, you're always aware of the symptom, and so you want somebody to feel better, right? So, but if I spend all my time just trying to do the fluffy stuff that makes them feel better, I'm probably not addressing the real issue that's actually wearing out that part of the body, issue, right?
Yeah.
And as far as your shoulder goes, I mean, so you've had problems for 10 years, right? You know that your shoulder was bothering you.
Yeah.
It wasn't as bad. It's funny because the way I hear you talk about it is 10 years ago there was pain. The pain went away. Now there's no pain and there's a severe limitation in your ability to move, right?
Right.
So it's interesting kind of how that morphed over time. And if you look at there's only two types, if you simplify, there's only two types of injuries, musculoskeletal injuries. One is an acute trauma. So I go out in my car and I got in a car accident and I go through the windshield.
Yeah.
Whatever happens.
Single event.
Single event. And as time goes on, with the single event acute trauma, typically our body gets better. Or we heal. Think of I like to use the analogy of my favorite superhero, Wolverine. So he heals himself, right? He gets shot and he heals himself within minutes. We do the same thing. It just takes us 4 to 6 weeks normally, right? Or sometimes maybe 3 months with acute trauma.
Yeah.
But the other injury is a gradual onset, where if you look at the history behind that is that, well, it's been going on for years and it's morphed, it's changed over time, and as time goes on, it builds and builds and builds and builds. And unfortunately, by the time we typically conservatively get to see somebody, they sometimes it's too late.
Yeah.
It's been so much damage that now we had a functional problem in the beginning, meaning biomechanics was messed up and it was a little bit of irritation. And that's pain, right?
Yeah.
And then it morphed into a structural problem.
Yeah.
And so now the structures got so worn out that they've actually now
the arthritis in that joint is the space doesn't exist anymore.
Right.
So in other words, I should have not ignored the pain.
The number one, if we talk about this in workshops, the number one biggest mistake that people make with shoulder pain or with back pain is that they ignore it.
Yeah.
Or they only treat the symptom for
It
a long period of time.
didn't affect the quality of my life to a significant enough extent at that time that I was willing to do what it takes. Now I can make any excuse I want right now, but that maybe is one of the messages and one of the things that I'm going to talk about with my clients and with my friends and my family is not ignoring pain, because look what happened to me.
Right.
It turned into a structural issue.
Right.
Whether it started in my back and then my foot, I don't know, but in some combination there. I have compensations all over my body.
Think about it it's hard. There's a big gap between what you know about biomechanics and what most people understand, right, about the body. So using simple analogies like a car. Yeah, if I have a car that the tires are wearing out on one side, right, I can, over time, if I let that go, I'm going to have to replace my tires, right? But if I figure out that there's an alignment issue, right, in the front wheel or whatever, and I can fix the alignment issue, then that damage that was happening, it doesn't go away, but everything else wears out equally, right?
Yeah.
So now you're balanced out. And eventually, like maybe it's a bad analogy, because eventually
No,
over time you are going to have to
I
replace your
like
tires.
that analogy, because if you don't, if a little prevention goes a long
Right.
way in saving a lot of money,
Yeah.
it's just difficult for us to sometimes want to pay for prevention.
Yes. Nobody wants to pay.
Yeah,
Nobody
right,
does that,
right.
right? That's definitely no one. When's the last time you got your furnace looked at?
Right.
And it was working fine, you know.
Right.
And so the question really becomes, when is the threshold? What's the threshold for somebody to all of a sudden just come to the conclusion that like they need to do something about
Right.
it? And I think you did probably like 5 or 6 years ago, and you know that may have been too late. It's kind of like, all right, well, we've worn our tire down to the
Yeah.
that little metal stuff that's in there, and you're
Right.
like, well, I that's not going to work for me.
No.
You know, so
But I'm
the
stuck with
reality is
that
some
tire
people
now.
need to have surgery, and that's just
Yeah.
how it goes, and
Right.
it's very helpful. I do think, and I can say this from my experience, that I do believe that, gosh, I mean, there are studies to support some of this, but there's a really large percentage of people that have orthopedic surgeries before they've given the body a chance.
Yeah.
And so you're not that person, but
Yeah.
I don't want to give you a percentage, but it's over 50%.
So for anyone watching, you'd suggest not ignoring pain, finding a good therapist who understands, maybe and respects chain reaction biomechanics.
Right.
And you're gonna see Andrew again, because after my surgery and when I'm ready to go after more aggressive and once I'm out of the passive phase of therapy, which is the first few weeks, we'll be back here for physical therapy, and we'll meet some of Andrew's therapists and keep you up to date on my progress.
Yeah.
Awesome.
You're gonna do great. Don't
Thank you.
worry.
Appreciate it.
And you're making the right decision.
All right. Thank you.